Myself Vaishali Ashok to discuss about topic name Monometry Application. Monometry, esophageal monometry is an outpatient test used to identify problem with movement and pressure in the esophagus that may be lead to problem like heartburn. The esophagus in the food pipe leading to from mouth to the stomach. The monometry measure to strength and muscles coordination of your esophagus when you swallow. The clinical application of the monometry. The first clinical application of esophageal high resolution monometry in the diagnosis of the esophagus conversion monometry in the clinical evolution of patient with the esophageal symptom, especially the dysphagia. The introduction of the high resolution monometry gave to rise new objective metric and recognizable pattern of the esophagus motor function, requiring the new classification scheme. The Chichango classification high resolution monometry measurements are more detailed and more easily performed compared to the conventional monometry. The visual presentation of the acquired data improve the analysis and the interpretation of the esophageal motor function. This lead to more sensitive, accurate and the objective analysis of esophageal mortality. In this review, they discuss how high resolution monometry change in way define the categories esophageal mortality disorder. Moreover, we discuss the clinical application of the high resolution monometry for each esophageal mortality disorder, especially the second application of monometry, lower esophageal sphincter relaxation characteristic using the slew sensor in the clinical monometry. We undertook this study to determine the characteristic. We shall include lower esophageal sphincter relaxation in the setting of clinical monometry using the standardized methodology. The slew sensor recording in the practical method for the clinical monometry that reliable record of lower esophageal sphincter relaxation characteristics and analysis routine. Relaxation of the lower esophageal sphincter pressure has a high diagnosis value of the HLCA. The third application of monometry, clinical accept and the monometry criteria in the HLCA. HLCA is the best known primary mortality disorder of the esophagus. The dysphagia is the main symptom, intermediate at the beginning but becoming more marked with the evolution. Although same peculiarities are the noted that are not sufficiently characteristic to establish the diagnosis. Chest pain is often associated with the dysphagia and may be the prominent complaint in the early stages of the disease. The dynamic investigation, mainly esophageal monometry, are needed for the diagnosis and follow up after treatment. These findings are commonly recorded increase in lower esophageal sphincter pressure, lack of relaxation and absence of the peristalsis. The better beginning for the diagnosis of the achalasia. On the basis of the monometric finding, achalasia is easily differentiated from the primary mortality disorder, that is diffuse the esophageal sperm nutcracker esophagus but not specific esophageal mortality disorder are the frequent. The monometry is also an objective method associated in the effectiveness of the treatment, that is the surgical myotomy or the balloon dilation of the lower esophageal spindle. The fourth monometry method have the improved the understanding the esophageal peristalsis in research research application but require the large number of the recording sensor. Commonly used to method limited for sensor wave compared to the topographical method to determine the whether the latter has a significant clinical utility. 200 patients referred to the esophageal monometry were studied with the data acquisition system having the 21 intraluminal recording sites, and the findings were analyzed independently using both limited. The topographical methods are more accurate and commonly used method in the diagnosis. The type of the several motor dysfunction and the provide the additional information important in the clinical practice and the esophageal monometry. Thank you.